It's estimated that nearly 40 million Americans suffer from some form of arthritis, either rheumatoid, osteoarthritis, or lupus. And of course, we know the kind of discomfort and disability this can mean: swollen joints and excruciating pain, frequently being so bad that it actually prevents a person from having a quality of life. Well, the mainstream medical community has done the best that it can, offering in some cases relief, but frequently not sustaining relief and almost never cures. The purpose of this documentary is to explore, are there techniques that have a different understanding of both cause and treatment? Is it possible by radical modification of lifestyle and diet, supplementation, detoxification principles to actually prevent or reverse all these different forms of arthritis? That's what we're going to explore. I'm Gary Null. Join me now as we take a look at Arthritis: A Natural Approach.
My name is Lori Mozoon, and I was suffering from traumatic arthritis induced by exercise, and the conventional medical prescription given to me was to have my right toe joint operated on to remove the calcification that had developed there from taking many classes of aerobics and ballet, which I didn't want to do because obviously it would have restricted my movement.
I guess I've abused my body to the point where I've experienced numbness in my left arm and pain, and to a point where I could not really feel the keys. I knew I was touching them, but I just couldn't feel the notes. And I decided that I had to do something, and I went to Shmuel Tatz, and he had an incredible approach of realigning your body, connecting tissues, working on areas that was causing this problem.
My name is Shmuel Tatz. I am a physical therapist working here at Medical Arts at Carnegie Hall. Together with me, Marius, who is exercise physiologist, and we together working on the body. Mostly what I am doing is hands-on. We're trying to go directly to the problem, to the arthritis, to the mostly our patients, people having traumatic arthritis from overuse syndromes or from accidents. And the work, what we're doing is to how more possible to go directly to the joint. If, example, you a pianist and you have a problem in your palm, we're trying to move your bones to separate the joint, to make more space between the bones. Today in physical therapy, we're using a lot of different modalities. One of the modalities what we like to use is magnetic pulse therapy. We know very good about effect of magnets to the body. Scientists develop special machine with different programs, what we can make adjustment for every situation, and the electrodes we're putting on the body, an example here in the hip joint, and this is stays for 15-20 minutes. Usually patients reporting very, very relaxing situation and pain decrease. Many people with severe osteoarthritis very afraid about touch or other treatment of the joint. Example, people coming with swollen knee, inflamed, very acute arthritis. We can do therapy, reflexotherapy. This means we can to do some kind treatment, example, on the ear, to stimulate acupuncture point, and with this kind of stimulation, we getting relief in the knee. Later, when patients feel better, more comfortable, next step, we starting to move the knee, to do exercise. This is the best de-stressing exercise for the joints. With the slings, we de-stressing the pressure on the joint. For patients, makes easy to move the body. We don't need to use the muscles. With this kind of exercise, we trying to open the joint, to make more space between the bones. This allows better circulation. Patients start to feel, again, I can move my body. Again, I can feel my joint. I know I can move, I can do, I can walk. But this is supposed to be done very, very careful. The same idea we can use for every part of the body. For arthritis in the back, for arthritis in the shoulder, for arthritis in the neck. To lift the body with the sling and to allow for patient to move the body and to feel you can play with your joints. You can enjoy with your movement. If you enjoy with your movement, you like to do movement. If you enjoy with your movement, you using the movement. And no question, movement is very important for people suffering with arthritis.
Here at Medical Arts, I was able to receive physical therapy, which has helped me to avoid the surgery and has greatly improved the quality of my life. And I'm still dancing.